Well, hello, everybody, and welcome to our Zoom session. We have a wonderful nurse practitioner with us today who's going to tell us all about the role of nurse practitioners and helping people age in place, which we're all committed to, especially since it's now personal. um, by anyone's standards, Andrena McDonald is an accomplished woman. She earned her Bachelor of Science in Nursing from Toronto Metropolitan University, followed by additional education and certification from York University as a primary nurse practitioner. After successfully addressing her own health challenges, she became committed to assisting her patients in reclaiming control over their own health. More important than even professional qualifications is Andrena's approach to her practice. Her goal is to listen carefully to her patients' health concerns and work with them to empower them in gaining knowledge that will help them thrive. This is why Seniors for Social Action Ontario was so pleased when she accepted our invitation to present to all of you. Andrena is the epitome of what we all want in a primary care provider. Andrena, we're all looking forward to hearing more, so over to you.
Thank you, Patricia. Thank you for having me. So welcome everyone. So I'm Andrena and I am a nurse practitioner. I am the owner of NP Health Clinic. And today I wanted to kind of talk a little bit about what nurse practitioners do, the role that we play in the community, and how we help seniors. So Harry, can we start the slides? So let's just talk about what a nurse practitioner is. So a nurse practitioner is a registered nurse. We have advanced medical training. Some of us have masters, doctorates. We're qualified to diagnose, treat, and manage medical conditions. We order lab tests, imaging, do referrals, and really, in a nutshell, we're looking at people in a holistic way. Our nursing care is combined with medical expertise, and we're really just looking at emphasizing patient education. We're looking at prevention and continuity of care. I mean, you'll see as we go throughout this presentation, nurse practitioners, you'll see them in so many different settings. And so, we're definitely, in terms of like part of the Ontario healthcare system, we definitely are part of trying to connect and help our patients and work with our other, team members like physicians. I just want to talk a little bit about like NPs and family physicians and what the difference is. Harry, can we go to the next slide, please? So really, a lot of patients ask me this question. What is the difference between you and my family physician? Well, there's a big difference, right? The family physicians, they're trained in medical school. They do a residency. They're focused on diagnosing and treating illness. Nurse practitioners, when we're trained like more through the nursing model. We're emphasized more on patient-centered care, and we're looking at the patient holistically. Both of us, like in terms of physicians and NPs, we both are vital in the healthcare system. Like what we're trying to do, especially what you'll see now, is because of the shortage of family physicians, where NPs are trying to fill the gaps. We're offering different types of services in the community. You'll see us in assisted living, in retirement homes. You'll see us in community settings, especially in home care. So we're trying to fill the gaps. And really the difference is that physicians have a different set of training. They're focused in different things. And we do work together really well because like if you'll find when you work with a nurse practitioner, we're a little bit more like, I mean, physicians haven't done that. A lot of the time they've not trained to do that bedside nursing. So you'll find that when we do that type of when we provide care to our patients, that's why we're so patient centered. um, so really, like let's just kind of like go into a little bit more about the next slide. I want to talk about the gaps in primary care. So let's talk a little bit like there's obviously people have heard that and know, and some of you in this audience probably have, don't have a family doctor. There's well over 6 million Canadians that don't have a family physician. And this is where the nurse practitioner role kind of came about so that we could kind of help and support physicians. That's how, like, we've been around for over 25 years. And so basically, in the last like 10, 15 years, the Ontario government is really just trying to advocate for NPs to be part of our healthcare system. You'll see us also in family healthcare teams, and you'll see us in our in your local. Sometimes you'll see nurse practitioners in your local physician office. And so, really, it all came about that when we started our training, we were like learning more about how to treat common illness and diagnose that. And that's what we kind of learned in our schooling as an NP. But over time, we started to evolve and start to kind of take on more complex cases. A lot of nurse practitioners, when they have more advanced years of experience, they can now go on to be more independent in their practice. And so a lot of the time, even with my practice, I have an independent practice. I work with physicians and I work with so many different multidisciplinary team members, but a lot of the time I just collaborate with physicians. In my practice myself, I run that myself. And if I need a physician's expertise, then I call on ones. But most of the time, you'll see us just kind of working independently. It depends on the setting. Um, so a lot of the time, like in terms of growing the gap into primary care, like the largest gap that we're seeing is that older adults are kind of not getting the care that they need. And so in terms of like the primary care piece, like obviously people are going to the ER, they're overusing the ER. We're finding that patients are getting fragmented care. And so especially with our senior population, a lot what's happening here is that people are going to emerge, they're spending hours upon hours, they're getting discharged. And one, they don't have a family physician to go back to say, okay, I need to follow up on all these recommendations. So what's happening is that's where the fragmented care is going on, and there's no like continuity of care that's happening. So a lot of the times seniors are just kind of like stuck because they're not getting the care that they need. They're being told that they need to follow up with their primary care provider. They don't have a primary care provider. So this is where you're seeing NPs kind of branch out a lot. And you're starting to see a lot of NPs do more independent type of work. Let's just go to the next slide, Harry. I want to talk a little bit about like bridging the access of care. So NPs, like I said, like you'll see us like in community-based primary care. And so when you go to see a nurse practitioner, most of the time we're following up with you on a really routine basis. Like we're so into like prevention and also making sure like we're managing chronic diseases, right? So basically in my practice, you'll see I will always follow up with my patients, especially my senior patients. They'll like every 3 to 6 months, I have to be seeing you. That might be me doing blood work or just checking in with you, making sure that, you have supports in place. Oh, are you taking your medications properly? Do I need to engage with a pharmacist to help you with that? So basically, like the relationship I find with a nurse practitioner and my patients, it's more relationship based, more continuity of care. Like we're not focused so much on giving a prescription. It's not symptom-based management. It's more like prevention. And so when you take that approach, and when I take that approach with my patients, a lot of the time you're reducing ER visits. There's a lack of hospital admissions when the supports are in place properly. So let's go to the next slide and talk a little bit about like comprehensive and chronic disease management. Like as a nurse practitioner, a lot of the time we're doing, complete physical exams, we're monitoring your progress. We monitor all kinds of illnesses. It's not just like, you come in with a sore knee and that's it. No, like we're monitoring diabetes, hypertension, all the different types of chronic illnesses you can think about. We're helping our patients. A lot of the time when patients come into my clinic, I'm like, okay, do you need to see a specialist? So I might need to do a referral, or do I need to send you for some imaging? So it's really kind of getting down to like what's going on. And a lot of the time I'm working with like naturopathic doctors or physiotherapists or sending to different specialist, or I have a team of professionals that I'm always kind of referring out to, and they collaborate back with me. That's the beauty of it. A lot of the time, I mean, I used to work in the public sector. I'm now, unfortunately, my clinic is not being funded by the Ontario government, right? So, this is a challenge, and it would be nice if it was, because this type of care I'd love to access to everybody. Unfortunately, like it's just not the case. But the thing is like what I've found, I've worked in the public sector for over 2 decades. And I've noticed that when I was in the public sector, I was not able to help my patients the way I'm able to help them now. At MP Health Clinic, like I'm able to spend like over 30 minutes with a patient. Sometimes, when patients are coming into their regular primary care provider, they're only able to explain one or two complaints. They're stopped after the second complaint and they're like, well, you need to book another appointment. The beauty of this type of care is that I can spend the time with my patient, finding out all the different things that are going on with them, and then come together with doing the right diagnostic imaging, the labs, all those things, and come together and also give them like a treatment plan. And then having other people, like other healthcare providers, help with that. I honestly have found that my patients, more than 95% of my patients have got better by taking that approach. So comprehensive chronic care disease management is so important. The importance of early detection and proactive interventions, it's imperative. Like I can name so many examples, like, things like just something simple. If I have a senior that's coming in and they're not being tested just simply for their B12 level, okay? A lot of seniors have low B12 levels, okay? When we do that and I start implementing a plan, just something simple, just like a B12 injection, you won't believe how like that just turns around for a person. It helps with their memory, helps with their cognition, it helps with their physical ability. So really kind of honing in on this comprehensive chronic care management is a key for, especially for seniors. So let's talk a little bit next. Let's go to the next slide and let's talk about the impact of NP-led chronic care. So symptom control is important, especially for the senior population. I find many seniors, if they don't have, unfortunately, they're taking lots of different types of medications. If you don't have, the proper, like maybe a blister pack or something like that to kind of help you, taking those medications at the right time, that can be an issue, right? So that's one of the things I like to do with my patients is make sure a lot of times everyone it doesn't understand is like, when you're giving a prescription for a patient, a lot of times patients don't understand because there's not being taught to them or explained to them that if you're taking like 5 medications, like say you're taking something for blood pressure or cholesterol, you shouldn't be taking all those at one time. It's a problem because like you cannot absorb all those medications all at the same time. So that education piece is really key, especially, I find a lot of nurse practitioners, they do a lot of that health promotion piece. And then, when we're doing that type of care, I really find that, there's an increased quality of life. Functional independence is better. We're always connecting with the patients and finding what's your support system. Do you have a support system? Can I help you and provide that to you? Do I need to, send referrals for you to get home care? A lot of the time in my clinic, I also do a lot of geriatric senior assessments. I have finding that patients are not kind of going through the proper care, like not getting proper memory testing. Do we need to reassess if you should be driving? Like all those things are important. And so, unfortunately, some of our healthcare providers are very limited with their time and they're not able to provide this type of care, right? So really, if you're trying to do this, like when I find that, the continuity, the compassion, open communication, that's what's helping our seniors, right? So it's an important point and definitely something that I do in my practice. Let's go to the next slide a little bit and let's talk a little bit about preventative and holistic wellness. This is a big part of my practice. You'll find nurse practitioners, like if they're working at, usually we're trained to look at like more comprehensive holistic wellness. More so, my focus is like this in my clinic. I really believe in this type of medicine. I've seen it help so many patients. It's not just about giving a patient a prescription, it's looking at other forms, like, looking at their nutrition. Let's look at your stress reduction. Are you sleeping? A lot of times, as you get older, your sleep cycle changes. And so unfortunately, I find that when some patients come to me, they're taking prescriptive medications for sleeping, and that's not a good thing. Okay, like, that can impact your cognition. So I try to take a different approach. Like, let's look at lifestyle. Let's look at some supplements. Let's look at some, and when I talk about supplements and vitamins and things like that, I'm talking about taking things that are not like fillers. For example, I don't want to name names, but there's like some brands that are just kind of filled with like not the greatest things for vitamins, right? So I like to educate my patients about things that they should be taking that's actually going to help them. If you're going to take a vitamin D supplement, why don't you think about taking something that doesn't have all these fillers that can affect you in other ways, right? Let's talk about the other thing I like to do in my clinic, which, a lot of people don't like to really look at, is a lot of people come to me about gut health. Oh, I've got bloating, I've got diarrhea, I've got problems with like every time I eat. There's things and there's tests that we can do that actually look at your gut health. And a lot of people don't realize is that when we look at your gut health, there actually is a huge connection between your brain and your gut. And so a lot of seniors that will come to me, they'll say that they've been anxious or they're depressed. They might not have any, like, there is a huge connection. I can tell you how many hundreds of people I have worked with, and especially seniors, that I've helped improve their gut health, and it's improved their mental health. So, looking at holistic wellness and prevention it's so important. I mean, I really encourage my patients to look at routine screenings. I always offer routine screenings. It might even be like, the guideline shows that, okay, over 65 or over 60, you're supposed to get a bone mineral density scan. But, if you have some symptoms that are kind of showing to me that you may possibly have osteoporosis, then I'm going to send you for that earlier. And I think that's key, having access to the proper testing, the provider that's kind of encouraging you to do this so you can be preventative. That's all part of the prevention and holistic wellness. Let's go to the next slide. A lot of what I do is empowering, and I find that empowering my patients, of all ages, not only older adults, but of all ages, is key. Having a tailored healthcare plan based on exactly what's going on in your body, it will change you completely. Having this type of approach, I've had so many patients I've helped where I've noticed that, I've done the proper testing and they were just lacking in maybe some magnesium or something like that, something simple as that, helping them come onto a specific treatment plan, working with naturopathic doctors as well, combining the care together and working together. I found it's helped immensely. A lot of the time, seniors will feel like, isolated. And when they don't have the proper healthcare provider to help them during this, it's detrimental. I've seen it many a time. Seniors will not have the proper support. They will go downhill. They end up having to go into a retirement home or assisted living, and it's detrimental. And it doesn't need to be that way. If you have someone on your side that is looking out for you and being preventative and looking at all different aspects of your life, there's no need for that to happen. I think, by giving education, by giving knowledge to my patients, it empowers them. It allows them to, get involved with community and get involved with like exercise and group programs. And it just really takes like some time. And as long as your healthcare provider is spending that time and investing in you and your health, it tremendously is a real it's a huge difference. I mean, a lot of times I find like, you'll see nurse practitioners, and I just want to kind of make this point because obviously my clinic is not being funded by the government, and hopefully in the future that will happen. But I just want to make this point because not all nurse practitioners maybe take this approach, like this whole functional medicine, holistic style approach, looking at seniors and helping seniors in this way. Unfortunately, we're divided in some sense because when nurse practitioners are going through their training and they've gone into the public system, they're kind of following this guideline. Well, okay, I'm seeing this patient and I'm just kind of like just going to get to the root to just kind of fix this initial complaint that they have. I'm just going to give them maybe a prescription, and that's it. And I want to make the point that you might not see all nurse practitioners how I practice. Okay, like they'll be in a family physician office and they're following like the guidelines of like how a family physician would run their practice. Nothing wrong with that, but I just kind of want to make that point. It's a little bit different when we're looking at holistic care and at the type of clinic that I own. My whole goal in practicing and even helping patients, especially my senior patients, is to really promote independence and have the dignity for them to have, to be independent. That's the whole goal of this and working with seniors. Let's go through to the next slide. I want to talk a little bit about collaboration because that's a huge part of what I do. Like I mentioned before, like a lot of NPs, like we are trained to do this. Like we work with specialists, we work with pharmacists, we are definitely involved with home care, and we work with families. That's a key part of what we're doing is that we actually are working with your family members. We're open to that. We want to help support you in any way that we can. We try to streamline what we're doing and we try to reduce the duplication of services that you're getting, right? So I'll have a patient that was in the hospital for many weeks at a time and they're like going to come home, and then there's a lot of like anxiety about that. So that's where I would come in. Are you getting the proper home supports? Do you have the PSW support? Do you have an occupational therapist to come out and help you set up your home? Like, so you have the proper handrails in the bathroom. Like, I'm able to, like, sometimes a lot of my patients, even though there may be a discharge planner in the hospital, they will always call me and they'll be like, okay, can you help me make sure that this is all happening? And I have no problem doing it and working with the home care team in the hospital to make sure, because unfortunately, a lot of times when my senior patients get home, they might not have the proper support. So that's why, NPs are really important in that way, right? We will definitely help collaborate and communicate with other caregivers and other professionals so that that care is being that care is being provided for that patient. So let's go to the last slide here. I want to talk a little bit more about like supporting and aging in place. Like, like I find that if I'm taking this type of approach, and NPs in general, when we take this type of approach with our patients are actually staying in their homes longer. If you're having routine appointments with your healthcare provider, they're managing your medications. Maybe some providers will do home visits, okay? Like all of that really does matter, okay? I've seen it time and time again when I practice this type of care, and many NPs do, like you'll see a reduction in hospitalizations and long-term care admissions because you're really kind of keeping an eye on your patient and you're really making sure that they're being preventative in their care. So I think like overall, I find like NPs, like if you're able to work with an NP, I find a lot of people that work with me like, wow, I've never even experienced someone who's listened to me and taken the time to really kind of go through my medical issues, right? So we're definitely an advantage in the healthcare system. I think we're definitely, I'm hoping in the future that the Ontario government will help us in terms of providing more NP-led clinics like this because they're definitely beneficial. If you ever get to, also the other thing is like if you ever get to work with an NP, I think you'll notice a difference in the way that the care that you're actually getting provided. I mean, I don't know, like they're wonderful. I work with physicians all the time, and there are some wonderful physicians out there. Okay, I'm just saying it's a different way of looking at healthcare. That's all, right? So, um, I think, I'm going to leave it on that note. Um, I'd like to take questions. Patricia, like, let me
Yes.
know.
Okay, and we're going to drop the slides, I think, so we can do that.
Yeah, okay.
Um, yes, Daniela Mergarten, you just mentioned she's doing the work of a case manager. To some extent, she is. Did you want to add to
Yeah,
that, Daniela?
Well, yeah, I've always thought that I'm lucky. I'm in Toronto, and I've been with Queen West Health Centre for over 30 years. I'm
Mhm.
going to be 70, and I think it just speaks to my robustness of, being low income and living as long as I am because of those services. And when we're talking about homes first and those kinds of things, we really need to look at that kind of wraparound services.
Right.
And I think, Andrea, it's really timely for you to start your own sort of thing, and I'm sure the money will come. I know that. What did I read this morning? It's a 2 billion or 8 billion. That's such a big difference in figures, but that the government is looking at putting that into hiring nurse practitioners to do that. So I mean,
yeah,
we're moving towards that.
yeah,
Um, having more care, and anyway.
Yeah.
I'm just, yeah, it's
You make an
really
important
time. Yeah,
Yeah, you make an important point, Daniela, because doctors are running private practices, but they're being funded by the Ontario government.
yeah, that's right.
Nurse practitioners are running private practices, and they are not being funded by the Ontario government
Yeah,
at a time when we have a physician crisis,
yeah,
when we have literally thousands of people without primary care physicians. And I know that a lot of older people, they've told us, prefer somebody who will practice more integrative medicine. And by that, I mean they will work as a team. If somebody has a naturopath or if somebody has a chiropractor,
mm,
or they will work with them to try in the best interests of the patients. And so, Andrina, I think that seems to me a big advantage.
yeah, no, definitely. Like, working integratively is the key to especially for our patients. That is the way that I have noticed that most of my patients have got better. Yes, I work independently, but I prefer to work collaboratively. And
Yeah,
that's where you find the key. A lot of people will get better quicker in that way. Yeah,
absolutely.
yeah,
The other thing that I keep hearing is that nurse practitioners are more likely to listen and take the time to listen and then thoroughly explore
hmm,
options with people,
yeah,
which, a lot of physicians they're very pressed for time. They often don't take that kind of time. And a lot of older people feel like they get dismissed. People have told
yeah,
us that.
yeah,
And, being dismissed by a physician when you're in pain or when you
yeah,
have issues going on that is really debilitating.
yeah.
So one of the things that we're hearing is nurse practitioners do listen and they do
Hmm,
respond with a variety of different options, which is also
right.
helpful because older
Hmm,
people want to make their own decisions. They know their bodies
that's right.
best. Most of
That's
them
right.
have been living with them for 7 or 8 decades, so they know pretty much what's going on. And certain
Mhm.
options are going to sound better, and other options are not going to sound as good.
That's
So,
right.
I
Yeah.
think that kind of collaboration with patients, I think, is helpful as well.
It's
So,
definitely a key. Hmm.
yes. So, Daniela, you have your hand up, and if there are other people with questions, Jennifer, I see your hand.
Hmm.
I'll go to you next after Daniela. Daniela, go ahead.
yeah. I was just thinking, like, as we move forward, what kind of difference in money? Because when we're looking right now, we know that about 90 of our beds are filled up in hospitals, people waiting for long-term care, which I've seen, a part of my parish going. losing people. They end up in long-term care and lose hope, and
Mm,
then they're gone. And it is so freaking sad.
It
So
is.
yeah.
anyway,
It
I've
is.
just lost a gentleman that's yeah,
Yeah,
that
it
just
is.
lived
It
across the
is
street from
sad,
me.
Daniela. And
Um, right,
yeah,
they need to stay in their communities, right? But in terms of, I'm thinking in terms of, how much money they would save. So why not fund the nurse practitioners?
yeah,
Yeah.
And like seriously, yeah, that's
yeah.
the point I'm trying to make.
Yeah,
Thank you.
you know what, Daniela, we have asked that question about a lot of things. Hospitals cost over $700 a day. Nursing
Mhm.
homes over $208 a day, and if they have dementia, over $300 a
Yeah.
day. And we're saying, you know what, home care is a lot
Mhm.
cheaper. Nurse practitioners who will deal with things holistically, a lot cheaper. For
Yeah.
some reason, the government is not funding in those directions. We think that's just common sense. So,
Yeah.
at any rate, so I agree completely. Jennifer,
Mhm.
you had a question too.
Yes, I had a couple of comments and questions. I'm a retired nurse practitioner myself. I worked in a family health team and up north, so everything you're saying is resonating with me. I just wanted to say that we have a brand new NP-led clinic that was approved here in Ottawa. It's meant to service over 5,000 people
Wow.
who are marginal, meaning homeless or drug abuse issues. Our native population is going to service quite a few thousand people. So this seems to be the type of NP-led clinic that is being funded by the Ontario government. So just so you know, it's a very needy population, as you can tell.
Mm.
So that's one bit of news. And the second question I had for you, after I retired, I joined the Council of Aging, and one of my pet um, tasks is leading what we call a NORC group, a naturally occurring retirement community. And we have three Oasis sites here in Ottawa.
Yeah.
And Oasis is, as you may know it, a program that originated in Kingston. But the people, the residents who live in these Oasis sites are really wanting more. And what they want more of is a nurse practitioner. And when I look at these three buildings and their proximity to one another, it would seem just logical that you might have a nurse practitioner who would care for those three buildings and be part of this Oasis program. So I put that question out to you to respond to.
Okay, so I think that's excellent. They should, but the thing is that in terms of like the only way something like that is going to happen is if obviously the government would fund that, right? And
Exactly.
so I agree with you because I have actually prior to opening MP Health Clinic, that's where I was going to start my practice was in a retired like in a building like it had older
Yes.
adults and it was
Mhm.
like a store three or four buildings and they had a hub where they actually had an office where
Yeah.
the residents would come in and they would
Yeah.
get care. So I agree with that approach, but
Hmm.
the only way, and this was hard, like this is really hard to say, this is a difficult conversation because really I wasn't being funded at all, right? I wasn't getting any funding. Like the only way that was going to really kind of happen was if I had to, charge patients, right? And this is what's happened with even my independent practice. I've had like it's not fair, right? Like to be able to,
No, it's not.
you want to provide care to patients, right? And the fact that you cannot provide the real care that you want to, and people have to pay for that,
Yeah.
I don't find
Yeah.
it's fair, right? So
No, it's
yes,
not fair. Yeah.
Yeah, yeah, that's the dilemma, right? And it's
Yeah.
yeah,
because the government isn't funding it, and they should be actually.
Yes, they should be.
But your point about NORCs, Jennifer, we're really pressing hard right now about integrative care and naturally occurring retirement communities through PACE programs, right? Where it's not just nurse practitioners, it's also OTs, it's also foot care, it's also a lot of other things.
Absolutely. And PSW care and integrating that
Yeah,
whole home
yeah.
care sector.
And
Mhm.
you know what? It really helps to have nurse practitioners supervising PSWs
Yes,
my
because
God,
absolutely.
yes.
because so many PSWs run into things that they're absolutely not trained to deal with. And if they have a nurse practitioner to back them up and to
Yeah,
provide supervision,
absolutely. Yeah.
what we're also doing, and what the government doesn't think about, is we're building capacity in those
Hmm.
PSWs because they're learning things that they
Yeah,
can then use with other patients as well. So,
absolutely.
that's what we've been sort of saying all along. But
Yeah.
Wanda, you had a comment actually. Did you want to make it to Andrena directly or a question? Wanda wants to know how much it costs.
She's muted.
Okay, you're muted, Wanda.
Oh, okay. So
There you
usually,
go.
okay.
I'm
So the cost of our services can range from $125 to 150 for a general consult, and that includes like a 30-minute appointment, and then it could be more than 30 minutes. Also, a 15-minute follow-up after that to review all labs and come up with a treatment plan.
In the 1990s, I worked for a community health center for 10 years, and I worked with nurse practitioners and doctors, and all of them were paid a salary in community health centers, and that still
Yeah,
exists today.
Yeah,
Um,
yeah,
yeah, they
and
are.
I haven't heard of many more community health centers being operated, but I was just really concerned about the exclusion of people, and that's certainly what I'm
yeah,
always thoughtful about or thinking
yeah,
about is for those people who have the money, great, go for it. It's a
yeah.
nurse practitioners are wonderful, but
Yeah.
it separates us as a society of those who have and those who have not. So has there been
I
any
know.
thought given to nurse, the whole idea about how to make, do nurse practitioners take on a certain number of patients that maybe pay a lower fee so that it's more accessible? Or are there other ways in which it makes it more equal to all?
Yeah, no, definitely. And I think this will come into play when obviously the government is talking about NPs able to bill OHIP. And that's supposed to come into play next year. When that comes into play, then I think a shift will happen, right? Because then if you're being able to bill OHIP, then the care, like the type of care that we provide, will be able to be available, more accessible, right, for people.
Yeah, exactly, which is why we're lobbying for it. Michael, talk to us about your experience with a nurse practitioner and what's going on in Waterloo Region.
Well, I deal with a nurse practitioner, and like I said, my first appointment was like over an hour, and we talked about everything. And when I see her, it's regularly now. It's a good 35, 40-minute appointment,
Mm,
and I don't pay. So I don't know. It's a Waterloo Region nurse practitioner that's clinic. So I'm not sure how they are
mm,
funded differently than other
it's
nurse
funded.
practitioners
Mm,
in the province, but I don't pay for my appointments, and it's nice and relaxing. We don't rush.
mm,
We take our time. She doesn't try to get me out in 10 minutes. Kind of nice. And we talk about lots of different things. And yes, I'm an
yeah,
older adult, so it's definitely nice because I have different medical issues that are propping up. So it allows us to talk at length about, okay, what's the treatment plan kind of thing.
yeah. Hmm.
Yeah, so is that funded, that clinic then? And
Yeah, I
who
think it
would fund?
is. It's
Probably the region, right? Would fund
the
it?
region. Yeah, it is. It is
Yeah,
The
so
funded.
region?
is
Wow.
everybody
Yeah,
listening? Is everyone
yeah.
listening? If your region is not funding a nurse practitioner clinic, then maybe it's time to go talk to your
Mm.
regional representatives and say it's time to get that to happen. Um, thanks, Michael. That's helpful. And Anna, you had a comment, and then Karen has her hand up. So Anna, do you want to go first? You were asking about our ends, Anna, so make sure you're unmuted.
Hi, my name's just Anne.
Oh,
So I
Anne, sorry.
there was an Anna on the line. I was just wondering if RNs were on your team and practicing to full scope, and if so, how are they paid or remunerated?
So I don't have any RNs as yet. I am looking for additional support, but when that time comes around, they will be. That is something that because it's private, they will be paid on an hourly basis, and it's funded from our clinic, from NP Health Clinic. That's how where they're not getting any funding from the government or anything like that. So yeah,
Mm.
unfortunately.
Yeah, so same problem.
It's the same problem. Yeah.
Same problem.
Yeah.
Um, okay, Karen, you have your hand up.
So I just wanted to call out that from everything you have said and my experience with a nurse practitioner is that you are very patient-centric versus working with family physicians. It's what's one symptom, you get 10 minutes maximum. And, you know, call me if it gets worse is something that drives me crazy. So I go to a family practice that it's the McMaster family practice. And I try always to get an appointment with the nurse practitioner because she will give me the time that I need, and she just looks at me differently than the doctor looks at me. And that leaves me with such a sense of I am being heard, I am being seen, and you understand what's going on with me. And so it keeps me from acting out with the doctors, which I have been doing well, by saying your family, primary care is not serving me well these days. So I'm very vocal about that. So I applaud what you're doing.
Thank you. Appreciate
I
that.
just really would like to see it covered by OHIP as well.
Yeah,
it would be nice.
We need them all over Ontario. I mean, interestingly enough, Andrena, the first nurse practitioner I ever came into contact with was in Sioux Lookout.
Yeah.
They had nurse practitioners up there doing incredible work because they had no doctors.
That's right.
They handled everything and every emergency, and Jen, you'll know all about that. But it was just extraordinary, and I thought, why do we not have these in Southern Ontario? But and what's really interesting is I noticed when people were registering for this session, we weren't getting people from north of Thunder Bay, and that's because they have nurse practitioners.
They have nurse practitioners. Well, yes,
they do.
That's true.
They do.
Yeah.
Okay. Are there other questions people would like to ask Andrena? I'm just looking to the Jen. Go ahead.
I just wanted to make a comment about something that's happening here in Ottawa. They opened a new clinic in Canada, and rather than hire nurse practitioners, they hired physician assistants, 2 or 3 of them. And people have asked me, well, Jenny, why would they do that? What? I said, because the PA works under the physician. And the nurse practitioner works under his or her own license. So they have independent authority. And so I think when we look at this whole issue, I think I need to call it out and say that one of the barriers is actually physicians to nurse practitioners having a larger role in our system.
That's so true.
I worked with 12 of them. I call them the 12 disciples at my family health team, and I had to fight for my position there and my value. And what I found is they assumed I'd be managing simple problems when I first came in, but what I ended up doing was managing all the elderly and their complex problems because I had an hour for a physical and half an hour for an appointment. So I had more time. And as you said, Karen, you listen and you hear and you rebook when you can't finish the appointment. So I think when we think about why we're not getting more NPs, we do have to name the issue. And that's one of them.
Overcoming
Agreed.
the physician lobby.
Good.
Yeah. The good old Ontario Medical Association. And we have found that again and again. It's really unfortunate because physicians, I mean, they do provide a service. A lot of people like to go to their physicians, and that's fine. But they shouldn't really have the ability to prevent people from seeing nurse practitioners if that's what they prefer. So that's actually kind of unfortunate that it's happening that way.
Yeah.
It is.
Yeah. Are there other questions? Betty Lou, you've got your hand up. You'll have to unmute.
Sorry. Yeah. I'm here with my friend Peter. He has a question.
Okay, my question is, okay, especially for people that are very low income, okay, are you only providing prescription for holistic medications? Because holistic medications are not covered by the Ontario government plan. So I'm just wondering if you needed regular prescriptions that are covered by the government, do you prescribe those?
Yes. Yes, I do. Yeah.
Yeah. And
Yeah.
all the drugs that are that a doctor can also prescribe, or they you still have to go see doctor for certain medications?
No.
Yeah.
Wow.
Okay.
Well, that's great. I
No,
think
she prescribes
wonderful.
regular medications.
Mhm.
She'll refer to specialists. She'll order tests. She'll order blood work. She'll do everything most family physicians will do.
Yeah. Yeah.
Okay. And just to mention, I know there's a concern about cost,
Yeah.
Yeah.
but consider this. Essentially, if somebody can afford $450 a year,
Yeah.
they
Well,
can
if
visit,
somebody
they
I'm
can
speaking
visit.
about can't. Oh, she can't hear
Yeah,
me, I
now
guess.
some people can't,
Yes, you
it's
can.
true. But if somebody can, they're basically that's 3 visits with a nurse practitioner where they take care of everything. They'll order tests, they'll order medications of, whatever type people need. They'll refer to specialists, like all the things that most people receive when they go to a family doctor. A nurse practitioner will do that, and they'll keep monitoring your blood work and see whether things are okay or not, or whether there needs to be a change in your treatment plan. So
I
for people
sorry.
who can, sorry,
I'm
go ahead.
able to get coverage through my extended health care plan with the
Good.
retired teachers, but it's lumped in a group of, you have $1,300 a year for
Right,
Yeah.
all, but
right.
I really want to see nurse practitioners, funded by OHIP,
Right.
Yeah.
like
Yeah.
doctors are.
Well, they
Makes
should be. They should be.
Yeah,
People shouldn't
they
have
should
to
be.
pay out of pocket.
Yeah.
Andrena will be the first person to say that. And I
Yeah.
think, all nurse practitioners that I know of who are in private practice
Yeah.
want to be funded by OHIP
Yeah, we
so that
do.
people
Yeah.
don't have to pay.
Exactly.
Yeah,
True.
yeah. Okay. So Michael, you're saying you think the only thing in your NP can't prescribe is narcotics? Sorry, Michael?
Yeah, sorry, I was on mute.
Yeah,
Yeah, that's what you told me, but there's a doctor assigned to the clinic. So if there's narcotics to be prescribed, she will forward that to the doctor who can then prescribe it if needed.
Oh, maybe she has a limited license or something.
Yeah.
Yeah, most of the time we take extra training in order to do something like that. So maybe she hasn't done that training.
Maybe, I don't know, but
Yeah,
right. So
but most of us do.
or at
Most of
least
us
there's
do.
a doctor assigned to it. So like if I did, luckily I don't need it, but if there was
Yeah,
a need, there's a doctor attached to the clinic that can actually do that.
Yeah, it sounds like
usually, yeah, you don't need to.
You
Yeah,
don't need.
usually, yeah,
nurse practitioners can prescribe
yeah,
narcotics, but
Yeah.
they have to be licensed to do it, as Andrea
that's
said.
correct.
Yeah,
I'll ask the next time I see her.
yeah. Daniela.
Oh yes. I just wanted to make a comment. Again, in regards to my health center, which I will recommend again, is Queen West. They really rock at Queen West. So in terms, yeah, no, they do, and I mean all the services. I do a lot of community services myself, but I mean it's just, and they're very welcoming, and just I've been, like I said, I've been there forever. But we have a naturopath, and it actually runs. They get interns from the naturopathic clinic, the people that are
Mm,
training to be naturopaths, and so they help with some of that cost in terms of supplements. I mean, I do
mm,
buy some of the supplements, but I also get help like with tinctures and stuff because they're in
mhm,
training. So it's a win-win situation.
That's good.
And I would like to see more health centers in the city,
Yeah.
yeah,
frankly, because that's the ideal.
that is.
It really works.
It works
I'm
well.
a prime example. yeah, I think of me as a case study, right? I'm my own
Mhm.
case study.
Yeah.
Thank you kindly.
Yeah. Daniela, I'm going to go back a bit here, but I actually worked for the first community health clinic in 1972, which will really date me. But,
Oh,
and you know what? We all thought that they were going to be expanded, and then they weren't, which was ridiculous. So we do have some, but we don't have nearly enough.
no, no.
Yeah. So anyone else have any questions for Andrena? Okay, I'm not seeing any other questions.
Yes, I
Go
did.
ahead.
I just wrote in the chat, but
Okay.
I moved to Eastern Ontario 3 years ago, and I still have a doctor 7 hours away. And I had an infection, and I called the nurse practitioner if she could prescribe my antibiotic for my infection. She said no, because I had a doctor 7 hours away.
Oh,
Never heard any practitioner turn patient down like that. I don't know. That's the first for me, hearing something like that.
Yeah,
Usually it's-
we lost our nurse practitioner a few years ago, and they opened up the clinic again
mm,
in Mallory Town, and
mm,
I called her because I said I can't go
Mm.
because it's so far away. So she said, well,
yeah.
the closest clinic that will allow people that are not in the area, I had to drive to Kingston, which is 40 minutes away,
oh,
to
I
get a
mean,
doctor to prescribe an
that's
antibiotic.
in my practice, I do a lot of virtual appointments as well. So if
Yeah.
that ever happened to you, then you'll be happy. I'd be happy to see you. My goodness, that's awful that
yeah.
happened to you. Like
Yeah.
I think there's a lot of patients that come to see me, and
Mhm.
they feel that because they have a physician that they still can't access my services, but they definitely can, and it's not an issue. So just
Oh,
yeah.
okay, great.
Mm.
Yeah, now
Um,
that I know about that, but it just
Mm.
frustrated me because
Yeah.
I couldn't find any clinic that was open in Brockville and
Oh,
in our
that's awful.
area in Gananoque, so I had to go
yeah.
all the way to Kingston, and I found that
Oh
so,
my
so
gosh, that's awful. Oh my
yeah,
Betty,
goodness.
where was your nurse practitioner located? Just for me.
in Mallory Town.
Did she have a private practice?
No, I think she was
No.
affiliated with a doctor.
There it is.
Oh, that's what it is.
That's the reason.
That's
Yeah,
why.
because you know what? That generally doesn't happen. And if she was working with a doctor, she would have been very careful not to offend the other doctor. I think
Mm.
that's so
Oh,
you
That's what
basically
happened.
got caught in politics.
but
Um,
there was no doctor on site. It was just her.
Mm.
And she's
but sh
funded by the government, of course, because that's how
Mm,
they opened it up.
mhm.
A pharmacist opened up this clinic, and the people in Mallory Town who do not have a doctor at all can go there. But because I have a doctor, I wasn't allowed to go. So,
Mm.
yeah, and it sounds to me like that's the political part because she's
Yeah.
funded by the government.
mhm,
So you heard what Andrina said. Nurse practitioners in private practice all across the province
yes,
will do Zoom meetings
okay,
with patients so that you can just look them up or, look up Andrina or look up others.
mm,
But you can call them and ask for a Zoom meeting.
okay,
And, I'm sure at that point they can solve the issue.
Yeah, no, and just to add on that, Patricia, just so people are aware that anytime I'm doing any type of virtual care, everything is like PIPA compliant, everything is secure, your information is secure, even you're
Yeah.
in a portal where I'm using a different type of platform, so it's a secure platform, so we're speaking in a you have your privacy matters, right? So it's
mhm, yeah.
just so you know.
Yeah.
So you only nurse practitioners are in Ontario, is that correct?
Yeah, yeah.
Okay,
That's correct. Yeah, I'm in Ontario.
yeah,
Mhm.
all right, because that's why I asked about the Zoom, because I thought,
Mhm.
can other
Yeah.
provinces use a nurse practitioner if they, like my daughter's moving to Nova Scotia, so I just thought,
Oh, oh, yeah.
They have. They have.
Yeah.
okay, great, thank you.
Mhm.
Okay. Well, I'm hoping that's a relief, Betty, that you you could actually contact the clinic and have a secure portal to talk to a nurse practitioner. So hopefully that'll solve that. And for other people in the province as well who are finding themselves in this situation. But we are hoping, and we are certainly going to be asking when we can expect nurse practitioners to be funded in the province, and we'll let the government know that we're hearing from our members that they want that. So,
Mhm.
is anyone else before we wind it up tonight? Okay. Andrena, thank you so much. I
Welcome.
really appreciate you having answered a lot of these questions,
Mm.
and I hope with all my heart that we can get some funding for nurse practitioners
It'd
so
be
that
nice.
more people can have access to them because, it is true that, people who can't afford it are
I
being
know.
denied healthcare, and that's really
Yeah.
very sad. So,
Yeah.
so thank you look at all the hearts coming up on.
Thank you. I
So,
know. Thank you, everyone.
so I know everybody really appreciated it, and I thank you so much for taking the
You're
time tonight
welcome. Thank you for
talking with
having
us.
me.
you.
Okay. All right. Good night, everyone.
Night.
Thanks everyone for coming.